Hello and welcome to another episode of Health Plus. Technology has developed so much that we can now see the unborn child before the child is actually born. Yes, it is this era of 4D imaging in the study of pregnancy and fetal well-beings. There may be many reasons for expected moms and fathers to see their baby with the help of 4D scan, but the most important interesting fact is that it helps to strengthen the maternal bond between mother and the baby inside the womb. It is said that in some cases, mothers used to talk to the baby inside and the emotions are captured. Now you can guess the thrill. In today's edition of Health Plus, we will discuss in detail about 4D fetal imaging and study the relevance and study of pregnancy and fetal well-beings. Today we have with us Dr. Rijo Matthew, and we are here to discuss 4D imaging. Welcome to our show, Doctor. Tell us all about imaging or scan, as it is called.
See, I remember my professor used to say that diagnosis is not the end, it is the beginning of the treatment. So a proper diagnosis and an early diagnosis is very vital in the treatment of a patient. So apart from the clinical examination that your primary doctor do, we need to have the laboratory investigations and imaging as a supplementary to the tests involved in making a correct diagnosis. So imaging now forms a vital part of a diagnostic workup. And there are different types of scans available, right from ultrasound scan to CT scan to MRI and the angiographies. A lot of scans are available. But the technology has advanced in all this imaging for the last 20 years that we have come to a stage where it is the 4D ultrasound or the four-dimensional ultrasound is the future of imaging.
Okay. Starting with 2D scan, what exactly is it?
See, in two-dimensional imaging, what we are getting is the images from a particular plane. But our body being a three-dimensional structure, we have got three different planes. We need to get data from all the sides. And as you know, we are in the information age. As many data is available, it can be analyzed and get proper information, and an early diagnosis is possible. So with 4D ultrasound, what is possible is we are going to get a volume image. In the sense, we have data from a particular region of interest. Whichever point that you mentioned, we have got pixels or voxels from that particular unit, and it can be reconstructed in different formats.
Okay.
So 4D is actually a volume image and 2D is actually a planar image. So that makes a lot of difference in the evaluation of a particular region, especially for pregnancy. With 4D, you will be able to reconstruct the volume data in such a way that you will be able to see the baby's face or the whole of the baby itself.
Okay.
This is just to show that our body has got three different planes, or what we call medically as axial, sagittal and coronal planes. So we need to get data from all these three planes in order to construct a total picture of the region of interest. Say in this case, this baby. So volume imaging helps us to give the information in these three different planes. And with the 4D technology, it is actually an advance in the computer technology. We will be able to reconstruct the images, both with different rendering techniques. Maybe for surface rendering, we get the body surface features. For internal structures, we can use the other techniques called as minimum intensity projection or maximum intensity projection. There are all certain 3D technology terms. And with this technology, we will be able to get more information about a particular area of interest.
So what are the advantages of having a 3D over a 2D scan?
3D when we are doing the real-time 3D, that means when we are doing the scan itself, we are getting a three-dimensional. That is what we call as 4D.
Okay.
So we get the movements as well as we will be able to see the baby's face, movements, etc. Then an evaluation of the internal parts, the live evaluation of internal parts, especially the fetal heart, in three different planes.
Okay.
So multiplanar imaging and reconstructions, these are added advantages of 4D scan, which is not possible with 2D scan.
Okay.
So you will be able to see a structure in 3 different planes. You will be able to reconstruct it, and you can use the different rendering techniques. And so for example, if you are seeing the bony structures, you can use a different rendering technique called as MIP, which will show you the bones and the ribs. And if you want to concentrate on the face, say for example the cleft lip has to be assessed, you can use the surface rendering technique.
Is 4D scan used only for pregnancy cases, or is it used for other purposes as well?
No. When 4D was introduced in last 5 or 6 years back, seeing a baby's face was it caught the attention of the world. That is how this technology became famous. But apart from pregnancy, 4D can be used in all other body parts, because what I said earlier, it's a volume ultrasound. Suppose if you are seeing the liver, you can get a total picture of the liver rather than getting a planar image. So this technology is there in all other modalities. 4D is applicable in CT scan, is applicable in MRI. So this volume imaging or the volume concept has changed the way we see things, because a structure can be seen in different planes and it can be reconstructed as if you are seeing the structure real time outside.
Are there any defects of the body that can be actually picked up in a 4D scan?
Definitely, especially in pregnancy, to look for the congenital anomalies of the baby.
Okay.
To look for the structural abnormalities of the baby, especially in relation with heart, brain,
okay,
and the abdominal structures, and also for the facial features, for example cleft lip, cleft palate. It is possible to see it very clearly. Not only see it clearly for the expert who is doing it, it can be shown convincingly to the parents as well as to the referring doctor.
Okay.
Major advantage of 4D imaging is, as I said earlier, about the volume imaging. The major advantage is its ability to do a multi-planar evaluation.
Okay.
Say for example, how many shoes can you see here?
I can see just one.
One. Okay. Now how many?
Now there are 3.
3. So all the other 2 shoes were hiding behind this larger one. Since you were seeing only one plane, you were not able to make out the other 3. And if you are seeing it from another angle, it's a totally different view of these 3 shoes.
Exactly.
So that is the importance of seeing a organ in 3 different planes.
Okay.
And since volume imaging is possible, 4D is basically a volume imaging.
Okay.
Volume imaging is possible. We can see it in different planes as well as do a reconstruction of the area of interest.
Okay.
See, our body is a 3-dimensional structure. So if we want to analyze an organ, we need to get the data from 3 different planes.
Okay.
What we call medically as the sagittal, axial, and the coronal planes. This is the coronal plane, this is the sagittal plane, and this is the axial plane.
Okay.
So you can get data from these 3 different planes. Body being a 3-dimensional structure, we need to get data from these 3 planes.
Okay.
So that is the importance of having a 3-dimensional scan. And the 4th dimension is time.
Okay.
The real-time 3D. That means while we are doing the scan itself, if you are getting a 3-dimensional image, that is called as 4D scan.
Okay.
So this is a baby's face, baby in the mother's womb. So you can see the reconstructed face image of the face. You can see very nice features of the nose, the lips, even the baby opening the eyes. Many mothers used to ask me whether the baby in the womb opens the eyes.
Okay.
And this is the proof to that.
Right.